Hello everyone and welcome to my YouTube channel. This is Dr. Naz and today I'll be discussing about occupational lung disease, which is also known as pneumoconiosis. So pneumoconiosis has a restrictive pattern and it is caused by inhalation of dust, either organic or inorganic. So in this lecture I'll be briefing about coal worker pneumoconiosis, silicosis and asbestos-related diseases. First of all is coal workers pneumoconiosis. It is caused by inhalation of coal dust and the occupation must be coal mining. The types are simple coal workers pneumoconiosis and complicated coal worker pneumoconiosis. The simple one is characterized by small radiographic nodules in asymptomatic patients. So in simple coal worker pneumoconiosis there will be only radiological abnormality and there will be no symptoms, and it doesn't impair lung function, and it rarely progresses once the exposure has been ceased. So these are the pulmonary nodules. The patient will not have any symptoms, and if you cease the exposure, the pulmonary nodules will not progress. Complicated is also known as progressive massive fibrosis, and it is characterized by fibrotic opacities with or without necrotic centers. As you can see in the picture, this is a black lung. So this progressive massive fibrosis can cause crippling lung disease, also known as blank lung disease. There will be productive cough and dyspnea. Melanoptisis may occur, which is black colored sputum. It can progress even if the exposure has been ceased. So this is also another difference from the simple one, and it leads to respiratory and right-sided heart failure in extreme cases. So it's a critical condition. As you can see, there is progressive massive fibrosis on the chest X-ray pointed with arrows, and it may progress even more if you have a continual exposure, and also even without exposure because it is progressive. Second one is silicosis, which is caused by inhalation of crystalline silica. It is the most common chronic occupational disease of the world, and it has two forms, crystalline and amorphous, but crystalline form, which is also known as quartz, is more fibrogenic and is more implicated in silicosis. So the occupations that are involved in the disease progression are mining, stone cutting, glass manufacturing and metal grinding. These all can lead to silicosis. It affects the upper zones of the lung, and it manifests after 10 to 20 years of continuous silica exposure, and it is usually a progressive disease even when the exposure ceases. So in the early stage it is usually asymptomatic. However, advanced stage is characterized by cough and dyspnea. The radiological appearance will show nodular opacities 3 to 5 mm in the mid and especially upper zones, and there will be eggshell calcification in the hilar lymph nodes. I will show you the picture in the next slide. Eggshell calcification refers to the rim of dystrophic calcification in the hilar nodes, and it is uncommon and non-specific. So these are the typical eggshell pictures. See, you can see the hilar lymph nodes are showing like an eggshell appearance. Silicosis increases the susceptibility to tuberculosis. It is due to decreased cell-mediated immunity. There can be risk of lung cancer and COPD. It is also associated with connective tissue disease. So the third one is asbestos-related disease, which is caused by inhalation of asbestos, and it presents 20 years after the exposure to the antigen. There are two types of asbestos, chrysotile and crocodylite. Chrysotile is white asbestos and it is most common type, but it is not associated with mesothelioma. The blue asbestos is associated with mesothelioma, which is crocodylite. So these are two types of asbestos, the blue one and the white one. So the first disease I'll discuss which is related to asbestos is benign pleural plaques. It is the most common manifestation of past asbestos exposure. There will be discrete circumscribed areas of hyaline fibrosis, and they are always asymptomatic. It involves parietal pleura of the chest wall, diaphragm, pericardium and mediastinum. See, you can see pleural plaques, and these are mostly asymptomatic. Asbestos-related another disease is diffuse pleural thickening. So the first one was involving parietal pleura, and this one is involving visceral pleura, and it presents with exertional dyspnea, chest pain, and restrictive lung disease, because there will the visceral pleura, which is covering the organ. Okay, so it is thickening, so it will restrict the lung. In this slide, you can clearly appreciate the thickening of visceral pleura marked by the arrows. So another asbestos related disease is asbestosis, and it refers to diffuse parenchymal lung disease. So the whole lung parenchyma will be involved, and it may present with exertional dyspnea and productive cough, fine late inspiratory crackles over the lower zones, digital clubbing, and progressive respiratory failure and right-sided heart failure may occur. And the complications include lung cancer, risk will be 40%, and it's increased with the concomitant tobacco smoking. And there will be 10% risk of mesothelioma, which is not associated with concomitant tobacco smoking. This is the picture of asbestosis, and it's showing parenchymal involvement. So the most dangerous among asbestos related diseases is mesothelioma, which is a malignant tumor of pleura and less commonly peritoneum. Its presence suggests past asbestos exposure. The clinical feature may include dyspnea because of pleural effusion, chest pain, and involvement of adjacent structures. It is invariably fatal. Chemotherapy improves quality of life and survival benefit for 3 months. Radiotherapy controls pain and limits the risk of seeding at biopsy sites, and pleural effusion can be treated by drainage and pleurodesis. You can see mesothelioma, and it's also causing pleural effusion. So this is the end of the lecture. I hope you learned something from it. If you do, please like my video and share it with your friends, and subscribe to my YouTube channel so that I get motivation to make further videos. Thank you so much for watching.